So what you're saying is that teenagers, this may, from strictly a sleep standpoint, may actually be more beneficial, while adults, it's probably the opposite.
It's more beneficial than the habitual early school start times that we had in place before the pandemic for a lot of kids. So, some of this is just my own observation, but I think that early school start times are a big problem for kids. And my observation has been that when the transition was made to online learning, that a lot of schools started later, and that was a wise choice. So let me say something about younger kids, though, while you're kind of thinking about that, because they don't tend to have this later tendency. I think for younger kids, this hasn't had quite so large of an effect on their sleep. Um, Again, we don't have data. This is kind of anecdotal and what I'm observing also in the kids of my patients, that for the younger kids, I think it's been a little bit more difficult for them to understand and appreciate why all of this is happening. And again, things that we can do to help make sure that they aren't anxious and having a hard time sleeping because of things like that is important for younger kids.
Now, how have you been able to screen new patients with insomnia? I would think sleep would be one of the easier things to do virtually in the pandemic.
Yeah, there actually is so as a clinical psychologist, most of what I do is cognitive behavioral therapy for insomnia, which is a short intervention. It is the recommended first line treatment for people who have chronic insomnia. And it actually is pretty well studied using telehealth modalities. So there have been studies of cognitive behavioral therapy for insomnia using video telehealth or facilitated by online programs that actually show it's quite effective. So that's the good news. We can still treat insomnia virtually. My clinical programs are 100% telehealth now. We were already doing a little bit of telehealth, so that made it an easier transition for us. Um, I'm also optimistic that our experience with telehealth in general will increase access to some of these specialty treatments that before now, I think a lot of patients would struggle to find someone who could do cognitive behavioral therapy for insomnia in their geographic region. And this may be an opportunity to actually expand the reach of those of us that are trained to deliver this therapy.
Interesting. Okay. I guess just to close things out then, what do you think the overarching theme of what we've learned in the last 3 months in regard to sleep really is?
In the last 3 months, I think we've learned that that we when we have big events that change our habits and routines, that there are pluses and minuses. On the plus side, I think we've learned that we're tending to do a lot of things that we viewed as essential instead of sleeping, that maybe once we had the opportunity to walk away from them, that it might be easier to prioritize sleep as we get back into our habits and routines. On the flip side, I think we've also learned about where the limits are in terms of how much sleep people need, and that when we extend beyond that in terms of time in bed, or when we pay less attention to our habits and routines and are kind of unstructured, that struggles with sleep increase. So I think we've learned some positive lessons overall, and we've also learned about where people might struggle.
Okay, well, thank you so much, Dr. Martin, for helping me.
You're quite welcome. Take care.